Acupuncture for IBS, a natural path to relief and restored balance. Introduction. Irritable bowel syndrome, IBS, affects an estimated 10 to 15% of the global population and remains a challenging condition to manage, particularly for those who do not respond well to conventional treatments. As people continue seeking more holistic approaches to digestive health, acupuncture has emerged as a potential ally. A recent clinical trial offers compelling evidence that this ancient technique may bring significant relief to those suffering from IBS, improving not just physical symptoms but overall quality of life. In this article, we explore the science behind acupuncture's effects on IBS, the mechanisms involved, and what the latest research tells us about its therapeutic potential. Exploring the study, acupuncture as a complementary approach to IBS. A recent randomized controlled trial involving 170 individuals with treatment-resistant IBS evaluated the efficacy of true acupuncture, TA, versus sham acupuncture, SA. Participants were divided into two groups and received biweekly sessions over a specific time frame. Those in the TA group reported a significant improvement in symptom severity scores, quality of life, and emotional well-being compared to those in the SA group. Notably, the effects were sustained even after the treatment ended, a finding that suggests acupuncture may create lasting shifts in the body's physiological and energetic regulation. One key takeaway from this study is acupuncture's capacity to serve as more than just a placebo. While previous skepticism has often centered around the idea that acupuncture's benefits are due to expectation or ritual, the data from this study indicate real physiological improvements in those receiving authentic treatment. Understanding how acupuncture works. Acupuncture involves inserting thin, sterile needles into specific points on the body along energy pathways known as meridians. In traditional Chinese medicine, TCM, these meridians are believed to conduct qi, vital life energy, and imbalances or blockages in qi can lead to disease. While Western science does not use these terms, it recognizes that acupuncture stimulates nerves, muscles, and connective tissues, increasing blood flow and activating the body's natural painkillers and regulatory systems. For people with IBS, acupuncture may help modulate the gut-brain axis, the bidirectional communication pathway between the central nervous system and the enteric nervous system in the gastrointestinal tract. Research suggests that acupuncture can regulate gastrointestinal motility, reduce visceral hypersensitivity, and modulate immune responses. These effects are critical for IBS sufferers, whose symptoms often stem from dysfunctional gut-brain communication, stress, and inflammation. Benefits beyond digestive relief. In addition to physical improvements, participants receiving true acupuncture in the study reported reduced anxiety levels and improved overall emotional well-being. This aligns with prior research showing acupuncture's effectiveness in alleviating psychological symptoms commonly associated with IBS, including stress, anxiety, and depression. Acupuncture may exert these mood-regulating effects by promoting parasympathetic nervous system activity, releasing endorphins, and balancing cortisol levels, all of which contribute to a calmer and more resilient nervous system. As IBS is often exacerbated by stress, the psychological support acupuncture provides could be a critical element in its effectiveness. Limitations and areas for future study. While the findings are promising, it is important to consider the study's limitations. One notable issue is the lack of double blinding. Acupuncturists administering the treatments were aware of whether the patient was receiving true or sham acupuncture. This could introduce subtle biases. Additionally, the study population was relatively homogeneous, and further research is needed across more diverse demographics to better understand acupuncture's universal applicability. Long-term follow-up studies are also needed to assess how lasting the benefits of acupuncture are and whether booster treatments are necessary. Future research could also explore combining acupuncture with dietary changes, mindfulness practices, or herbal medicine to assess whether a multimodal approach offers greater benefits. Conclusion: acupuncture represents a promising, well-tolerated, and holistic approach to managing irritable bowel syndrome, especially for those who have exhausted conventional options. With its ability to support both physical and emotional wellness, acupuncture may help restore balance in the gut and the nervous system, offering sustained relief from the complex symptoms of IBS. While more research is necessary to confirm these findings across broader populations, acupuncture's role as a complementary therapy is gaining deserved recognition.